From the very beginning, one of the things that we wanted to make sure is to address the problems within community, that we needed to do it in conjunction with community. So we hired people who reflect the communities that we serve. I see within my own family the effects of poor health care. Center for MultiCultural Health is a nonprofit, community-based organization that works to eliminate health disparities in communities of color. When I first started, was hired to close the program down. When I came in and saw that the programs were staffed by people who came from the communities, they were committed, and they worked really hard to get the services out to the communities. I talked to the board and got them to see the value in that and to restructure ourselves and rename ourselves. And so that's how we became the Center for MultiCultural Health.
Today, we are in Federal Way providing health education, health screenings. Health screening is blood pressure, cholesterol, glucose screening. We're also screening for kidney disease. And we also have Seattle Cancer Care Alliance here. They're partnering with us to provide on-site mammograms for women who are 40 and above.
In the United States, a couple of generations ago, in my community, African American community, you didn't say the word. It just was not done. The purpose of a mammogram is to find something. The earlier you find it, the easier it is to treat. I had a client, her very first mammogram, they found something. She had an appointment maybe 10 days later. She was vibrating. I talked to her almost every day. I went with her. She was so brave. And it was something significant on screen, but it was simply a benign, meaning it meant essentially nothing. So I tried to bridge that gap and reassure them that if it is something to be concerned about, wouldn't it be better to know about it now and take care of it? That's what I want. I want them to grow where they can be assured of how they're feeling, and they can talk to someone else and they may be that person's advocate.
We serve the community and we represent the community that we serve. The African and African American community have been targeted by big tobacco for generations. And there is an enormous distrust within our communities of medical institutions, which has really led people in our communities to self-medicate with substance abuse. STAND, which is an acronym for Speaking Truth and New Direction, works to empower youth and give them the agency and teach them the tools that they need to advocate for themselves and to see past the targeted advertising. I've also been able to put more of the directing into the hands of the youth so that they have a real say about the trajectory of the program. I wanted to work at CMCH because the work that they do in the community, honestly, I think is unmatched. It's amazing.
What struck me is when I came in, I saw people who look like me, who speak like me, who have experienced the same challenges that I have experienced, and I felt at home. We definitely know that there is a lot of stigma associated with HIV in itself. When I tell them that I've lived with HIV for more than 23 years, and they think, oh my goodness, so I can survive. That makes it easier for the community that I serve to even trust me with that sensitive information. You don't have to live a miserable life because you're HIV positive. There is access to medication, there is access to social services.
A lot of times people feel like it's hopeless. From the staff point of view, they can tell them there is a solution. This is how you get it. And I will be there with you every step of the way.
There is no need to hide. There is no need to be scared. And there is no shame. Even though you're not telling the world who you are and what you're going through, but at least talk to one person. and I'm there. I'm that person to talk to you.